I'll pass the microphone on now to Eileen St. Croix, who's a family physician who practices in the Gander area. She does entirely chemotherapy and palliative care and the occasional merge shift.
My first exposure to palliative care was as a first-year med student nearly 4 decades ago, not 40 years ago. And at that time, I was totally intrigued by palliative care and the relationship that I could develop with the patient and their family. And that has stayed with me for my 34 years of practice in rural Newfoundland. To me, palliative care exemplifies family practice, as it is, for me, the total care of a person who has an end-of-life illness. And I achieve that care by coordinating with the person what their desires are, their family, what their capabilities are to care for this person, and what resources I have in the community in terms of nursing support, social work support, pastoral care support, and physician support. Because my main objective is to provide total care to that person during their final days of their earthly journey. But in rural Newfoundland, it is a challenge to fulfill this mandate. There are many reasons for this. Some of them we can't change, like geography, weather, or the diagnosis the patient has. But others we can change, like the number of physicians, the availability of nursing and home care support, and support for the family. We all realize that we are very much more comfortable in our own home environment, and for most people who are dying, this is what they would prefer. But if you live in a small rural community in Newfoundland, 100 kilometers or more from the nearest hospital, and you don't have a family doctor, then it is pretty difficult to die comfortably in your own bed with your cat and your dog with you, which is what I'd like. Unfortunately, many Newfoundlanders end up coming to a healthcare facility which might be an hour or more from their home. They're admitted to a doctor they've never seen before, and they're at the end of their life, and their family is trying to cope with it. They live an hour or two away from their home, out of a suitcase, running to Tim's to get a cup of coffee. And these people are not admitted to fancy palliative care units because they don't exist in our rural hospitals. We feel quite happy to have a special room for palliative care, which we decorate a bit better. But our nursing staff that look after these palliative cases also have to look after people having heart attacks and strokes and managing diabetes. So they can't always be there to provide the support to the patient and their family that they require. For me, I try and look after as many of my patients in their home environment as I can, but oftentimes that means traveling as much as 100 kilometers to see one patient. I feel it's a valuable use of my time, but it impinges on the other things I have to do. It impinges on the people I have in hospital. It means that I am on call every day, 24 hours a day. I'm in the hospital every Saturday, every Sunday. And this is difficult. I do it because I like what I do, and I feel what I do is a valuable job. But in order to provide good palliative care in the year 2010, we need to have family physicians who must be a part of these regional teams, which we all hope will be developed. And these family physicians must be dedicated to providing palliative care in the communities. And they will require support from up-the-line palliative care consultants and from other allied healthcare professionals as social workers, occupational therapists, and nurses. As we develop these teams, we need to know people who have special interest in training in palliative care to coordinate together. And to do this, we will need family physicians in rural Newfoundland who have chosen to come to that area, who are happy to become a part of that community and to share in the lives of the residents of that community in all aspects of their life, in the good days and in the bad, from the time that they are born until they die. And that, to me, is family practice and palliative care as a part of it. Thank you.